At around 10 o'clock this morning, it looked like the government's changes to Medicare were still alive.
No, we'll persevere. The Senate has its role and we always deal with courtesy and respect with our senators. We'll continue to make the case that this reform is necessary, it's thoughtful, it's prudent, it needs to be implemented because the longer-term sustainability and affordability of Medicare is too important to be left to some short-term politicking and populist reaction. When you talk with everybody, they argue change is necessary. This change is on the table, it's being implemented, it's an important measure, and there's no alternatives being advocated by anybody.
But by 12:30, the newly minted Health Minister Sussan Ley announced she had frozen the measures pending further consultation with the community.
I'm announcing today that the changes to Level A and B Medicare consultation items will not commence on Monday as planned. The government is taking them off the table. However, it remains critical that we implement changes to ensure quality care for Australians and a secure future for Medicare. I'm announcing today my strong commitment to undertake wide-ranging consultation on the ground with doctors and the community across the country in order to come up with sensible options to deliver appropriate Medicare reform.
The Australian Medical Association welcomed the news and called it a win for GPs and patients.
The Level A and Level B changes were always going to be a problem. I'm glad that common sense has prevailed in getting these changes off the table. It is a win for grassroots GPs and their patients, and I think this is a very good outcome for GPs, driven mainly by a very grassroots local campaign by GPs in their communities, and I think it's been very successful, and I'm glad that the government has acted and that we don't have a situation where we have to go through this drawn-out process of disallowing the regulations through Parliament.